If we get people to take their seats, and we'll start the third session. So we'll go out and do a little cat herding. What's that? Okay, thanks. If everybody could take their seats, and we'll get started on the final session for today, Theme 3. I hope everybody is feeling sufficiently intellectually stimulated and well-fed simultaneously. It's not sure what's been stimulated more, our gastric system or our intellectual lives. So Theme 3 is focusing on research agenda setting and uptake, and it has three key components to it: power, justice, and fairness. And we have three excellent presentations that will be coming up, and I'll introduce each of them, and we're going to go in turn from Ehsan through Maria to Guimel. Next slide, please. So I've got, they haven't started the clock yet, which is great. Supposed to sort of set the theme. I'm glad that Professor Capon mentioned COP29 and the odd event that it took 28 conferences of partners before health made its appearance, which is rather strange. And I'm wondering how long it's going to take for ethics or values to make an appearance. And I met Tony at a conference. We thought maybe if we could get an ethics panel at one of the future COPs, maybe not 29, maybe 30. Do you think 31 is too pessimistic? That would be a way of transforming some of the thoughts that we've started to explore today and tomorrow, because I think they're actually of constitutive importance to our understanding of the challenges that climate change poses to humanity. And of course, the language, and as the UN at the beginning of this process, and it's worth checking in. There's a daily summary of the proceedings, and the conference goes on until the 22nd, so it's entering its second week. And just to see what the highlights are, and to ask yourself how our thinking here connects into the thinking that's going on at COP29. And it's actually, you know, there's a lot of discussions about, how much money do we need to raise? $1 trillion. And so then you think, oh, okay. So what's that money for? How is it going to be spent? How is this going to be allocated? To what purpose? What are the ways in which those decisions are going to be guided? And if they're not guided in some way by ethics and values, I'm not sure what they're going to be guided by. So you may think that this is a small meeting in Kuala Lumpur that's focusing on how research ethics connects into climate change and health. But there's a bigger, I think, and broader dimension to the issues of how ethics values play in our deliberation about the ensuing crisis. So we're, adapt or perish seems like a rather strong question that we're focused on. So as we know, the world is getting warmer. 2023 was estimated to be the hottest on record. The data isn't in on 2024, but I can assure you that the same headline will be soon in front of us saying that 2024 is the hottest on record. So I want to just sort of contextualize just a little broader what we're thinking about here and why it's important. And Antonio Guterres, the Secretary General of the UN, sometimes I wonder how both he and Tedros wake up in the morning and get to work to face the immense challenges that are on their plates, heading up major government, intergovernmental, things like the UN, where nation states and sovereignty play such a huge role in decision making, yet they're both committed to finding ways that point out the common strategy, the common burdens and challenges that we all face. And so on Earth Day in June of 2024, he gave a special address on climate action, and he called it a moment of truth. Now, what was he saying? So he said, in the case of climate, I don't want to give away my final one. In the case of climate, we are not the dinosaurs, we are the meteor. So a lot of what we're experiencing is self-caused harm. We are not only in danger, we are the danger. But we are also the solution, and I think we've all started to identify the complexity of what those solutions might look like. We're playing Russian roulette with our planet. We need an exit ramp off the highway to climate hell. And the truth is, we have control of the wheel. The 1.5 degree limit is still just about possible. The truth is, the battle for 1.5 degrees will be won or lost in 2020s under the watch of leaders today. All depends on the decisions those leaders take or fail to take, especially in the next 18 months. So that was June, that was 3 months ago. It's climate crunch time. Now, not to depress everybody too much, we have to recognize, of course, that recent political events have actually, if we're going to talk about power, and if we want to seriously engage with how power intersects with research and health research, we're going to have to acknowledge the fact that certain forces have been let loose upon the planet. And drill, baby, drill is perhaps not the most environmentally friendly or eco-friendly or taking planetary health into the consideration it should be. Now, this isn't just to depress us or to give us that we should quit. I think actually it just reinforces, the black hole. No, it reinforces the paramount importance of bioethics, of ethics, of the discussion of values, and how we actually enact that, not just in our research, but as we've discussed earlier in terms of the governance. So today we've got 3 excellent presentations, and I meant to mention, I'm sorry, at the first slide, to acknowledge the contributions of Professor Cheryl Cox-McPherson, who is to be my co-chair on this process. She's from St. George's University in Grenada. As a bioethicist, she's been thinking deeply and posing very astute and penetrating analysis of the relationship between bioethics and climate change for quite some time. And unfortunately, she's not here today, and just like Julian's not here, Julian Sheether, we've lost 2, I think, tremendous resources of people who have actually grappled with that, and we're unable to engage them in face-to-face conversations. But I would like to thank her contributions. Was absolutely essential in our elaboration of the presentations that you're soon to see. So we have 3 presentations, and we've set it out in the research agenda that, climate change prompts research investigating severity, prevalence, modes of transmission of, and effective interventions against health impacts. Research agendas and other factors influence the aims and approach of different investigators and funders, political and business leaders, and others that influence the research agenda setting. The extent of research uptake by a target audience varies with knowledge, needs, and priorities, local, political, and other interests. So we've given kind of a background macro political structure. But now we'll move to the panel. So our first speaker is going to be Ehsan Shamsi Gooshki, and I'll have him come up to the microphone here, and over to you.
Thank you so much. It's such an honor to speak in this forum, and I thank for this opportunity and for the fascinating structure of this program, because I think that the previous discussions very carefully set the scene for what I'm gonna to share with you about one case that I was basically engaged when I was in research policy making, and I was secretary of National Research Ethics Committee in Iran. At that time, we were establishing one funding body, funding agency, NIMAD, National Funding Agency for Health Research. And at that time, I was a little bit thinking about the best research practices, difference between investigator-initiated or sponsored research projects. Okay. Mr. Arzan Lu, his picture is here, was a master's student in civil engineering with a focus on watershed and flood modeling, traveled approximately 1,000 200 kilometers from his city in Khoy to Qala, Golestan province in Iran, which is renowned for its stunning natural landscape, rich culture, and historical heritage. It was a kind of vacation trip. As someone increasingly aware of the impact of climate change, particularly the rising intensity and frequency of floods, Mr. Ehsan visited the Gorgan River, which flows through Qala town. He observed various factors affecting the river, including the lack of dredging, inadequate watershed management plans, and upstream deforestation, all of which pose a significant flood risk to the city. On his return, he sought assistance from 2 faculty members, 2 professors, to help him to draft a paper on what he witnessed during the trip. And finally, the paper, using online data, analyzed flood risks in the Qala region, recommended sustainable urban planning, infrastructure improvements, identification of risk areas, and ensuring accessibility and necessity of evacuation. And this was only based on the online data. He approached local authorities for data about the river situation, but it was refused because maybe the local water management authorities thought that this is another faculty member in one university that wants data for academic promotion. And this could be the understanding. And they refused to provide him data, so they did it with online data. The paper provided a detailed prediction of high water velocity in the event of flooding across various parts of the town. The paper also predicted a high discharge rate of flood water, detailing its impact across various parts of the town. And finally, as a conclusion, the paper predicted dangerous levels of flood hazard for Qala, the city. 2 years later, the nightmare became a reality. After the town received around 300 millimeters of rain in 48 hours, the consequences were devastating. As you can see, 270,000 hectares of agricultural lands were destroyed. 12,000 houses were destroyed, and the total estimation of damage was around $500 million in that area. In this case, although the paper findings could have guided local authorities in their urban planning, in crisis management efforts, and also serve as crucial input for developing flood insurance mechanisms and disaster preparedness strategies, a pressing question remains: why did local authorities not pay attention to this research? And this is the main issue in this case study. During the flood and after the flood, the paper came to social media and also the TV and everywhere, and everyone was asking why this paper result was not captured and absorbed. The Minister of Energy at that time was called to Parliament because of the inaction. One official report of the Water Research Institute, which is affiliated with the Minister of Energy, valued the social impact of the research, but noted that its findings were not shared directly with relevant authorities to justify why they did not acted according to the results. And the same reports mentioned that while explaining and justifying the Ministry of Energy did not respond to the study findings, the institution emphasizes the need for targeted strategies to integrate insights from such academic publication into governmental processes effectively. And this case study provides us with 4 main themes, which the first is the ethical implications for local funding agencies' role. The question of who gets to ask research questions is critical. While investigator-initiated projects could be beneficial, the results of such studies would be more isolated inside the academic circles and less weighted and absorbed by the end users than sponsored projects. The Qala flood case, it could be argued that had local authorities funded the study, the findings might have been more likely to influence the decision-making. The situation underscores the vital role of research governance and funding bodies in ensuring that results are absorbed and utilized effectively by those who need the results. Well-organized funding agencies can fill this gap by bringing together those who need the scientific evidence to pursue their missions and those who can produce such evidence. And this is an ethical issue since it could result in more efficient use of scarce research resources and local funding increase the possibility of local engagement. The second theme is about participatory research, collaborative partnership, and engagement of local communities and related authorities. The fundamental issue in this case is the crucial place of engagement of local communities and authorities in research process even after publication. Qala study does not include elements to ensure that the final results are adopted and utilized effectively by strategies such as engagement of local authorities and community members. As reported by investigators, the main barrier to such engagement with local authorities was their lack of cooperation in providing enough data about the river despite the investigation approach. But the investigators approached the local authorities for data, not for engagement. They just went and say, please give us data. And this is different with local authority engagement. And while the domain of health research, community engagement, and collaborative partnership are known ethical issues recognized by research ethics education programs and research ethics committees, which are mostly established in medical sector, there is less sensitivity in areas such as engineering, for example, civil engineering, about these issues, despite the huge potential impact of such projects on human health and well-being. If this was in clinical trial, the research ethics committee for sure or may ask for plans for post-publication dissemination of results or collaborative partnership and community engagement as we, as members of research ethics committees in different levels, require from investigators when reviewing their proposals. The third theme is need for a holistic approach to health, and I think it was enough discussed in previous sessions. So the interconnectedness of health of animals, plants, and humans manifested in concepts such as One Health and planetary health enables us to better understand that health and environment and even engineering are intertwined. In October 2024, World Medical Association adopted a similar approach within Article 11 of new edition of Declaration of Helsinki that requires medical research should be designed and conducted in a manner that avoids or minimizes harm to the environment and strives for environmental sustainability, which is adoption of the principle of environmental sustainability by the World Medical Association. This shows a kind of holistic approach of World Medical Association, more holistic approach, while we know that the Declaration of Helsinki is mainly clinical trial centric and anthropocentric. Even when the Declaration of Helsinki discusses, for example, post-approval access for medical products, it just talk about clinical trials, for example, and AI tools are not included in that post-approval access. So it's clinical trial and medical research centric, but at the same time, it endorses the environmental sustainability as a new principle. Another related example is the antibiotic resistance that could be exacerbated by the flood, and it is evidence-based. And such a holistic approach justifies and underscores the need for expanding the current biomedical model and research ethics frameworks, including their both substantive, such as community engagement, and procedural content, such as ethical review, to research studies with a significant environmental impact. And the last theme is improving the social value of research by facilitating its translation to policy or action. For research to achieve tangible social value, it doesn't enough to be socially valuable on its own. It also requires collaborative efforts from all stakeholders, including policymakers, to translate research findings into effective, beneficial policies or actions. Otherwise, the real social value would not be realized. Examples could be the improvement of the sensitivity of authorities and policymakers to available scientific evidence, or advocacy by researchers, science advisory structures, and other stakeholders for procedural values, including evidence-based decision-making, transparency, inclusion, and accountability. And it is a valid, alive question that, however, the extent of researchers' responsibility to inform the related communities and authorities about the important and meaningful results of the studies in fields similar to this case is a valid question. So we really need to discuss what is the responsibility and the level of responsibility and moral obligation of researchers for doing all of this. In conclusion, this case study underscores the significance of a specification of research ethics standards for the climate change and environmental research to avoid isolation of the findings from public and policymaker attention that impedes practical application. For example, how risk-benefit analysis or how post-approval access of medical products to the participant of communities could be specified in the field of environmental and climate research. The second issue is applying research ethics standard for climate change and environmental research, again, including procedural and substantive values like ethics review and community engagement and collaborative partnership. And finally, it underscores the understanding of, to enhance our understanding about the collective responsibility for ensuring the ethical conduct of research that extends beyond just researchers and include funding agencies, research governance bodies, academic institutions, scientific journals, and other stakeholders. These are cascade gatekeepers to protect observing ethical principles in environmental research. Last but not least, I really acknowledge and thank the GFBR program for the opportunity that let us discuss on this. And and also I really thank my co-author on this case, Mr. Ehsan, who did this basic research. I tried with guidance of Ross, I tried to find him and I approached him. He kindly shared all the information about the background with me. And also the reviewers of this case, I really enjoyed and used the comments by Ross and Cheryl and also Adrian. All of them provided very good and constructive insight to this case study. And thank you.
That we do all three presentations and then have our questions, because we started a little late because I was a little lax in enforcing people's coming in. So our second, can move to the next presentation. Our second presenter is María Victoria Gerbaldo, and she's going to present a study that describes engaging grassroots women's organizations in co-producing knowledge about effective climate health responses and some of the advanced method they call transdisciplinary reflective equilibrium as a means of mitigating associated injustice. Without ado, so over to you.
Thank you. Good afternoon, everyone. It's an honor for me to be here today. I'm going to share with you a research project in which we are working this year. I'm a member of a research team, and this project is supported by a GLIDE initiative and is hosted by Climate Ethics and Development Foundation in Argentina. Next slide. Well, in these 15 minutes, I'm going to introduce you the research team. I'm going to explain the case study context, the objective, and the methodology that we are using. I'm going to justify why we choose Paraguay for this pilot case using this method, why we decided to work with women's grassroots organization, and then walk you through the ethical issues related to this case, the conclusion, and the recommendations. The next one? Okay. This is the research team. The ship's captain is here with us, Dr. Romina Reckers. And also, I'm working with Dr. Carlos Yavar, who is based in Peru, Cynthia Rodriguez Garat, who is based in Argentina, Lucas Reckers, who is based in Argentina also, and Marcia Videla Ayala, who is based in Paraguay. Next, please. Thank you. So climate change requires a revision of ethical rules in health research. And I state this because climate change reshapes research benefits and risk in global and intergenerational dimensions. And this study examines the benefits of the co-production ethical rules for climate-sensitive infectious diseases research with women grassroots organizations. We are working with academic and non-academic participants. So the objective is to co-create ethical rules for climate health research, and we are using transdisciplinary reflective equilibrium, which is that. Reflective equilibrium is a method in moral and political philosophy in which philosopher presents principles motivated by arguments and examples, and adjusting their principles to the judgments suggested by the arguments and examples. So it's a method that implies an exercise to go forward and back. And we're using this method in a transdisciplinary way in which we are having ethical conversation with academic participants, which are the member of the research team, and with non-academic participants, which are the members of the women's grassroots organization. All of the participants of these ethical considerations has equal control of the research. Academic and non-academic participants propose cases for this ethical conversation, and we identify two key moments. The first is when we identify responses to the cases or ethical dilemmas, and the second moment is when we're revising ethical rules. And our outcome is normative. So we are working with a moderator, and we are guaranteeing scientific accuracy in all of the process. So I'm going to share with you one of the case examples. It's an hypothetical situation that we are using in our ethical conversation to, well, for having a better idea. So this case is the distribution of vaccine trial benefits and the different climate scenarios. So a clinical trial for chikungunya vaccine in Paraguay potentially benefits future generations worldwide. Under a high-risk climate scenario, Central Europe may face increasing vulnerability to chikungunya by 2050, while current communities in Paraguay, where the trial is conducted, face immediate exposure. And then we introduce some ethical questions for all of the participants, academical and non-academical participants. So should we count only the potential benefit for the vaccine for the Paraguayan current generation and future generation, or we also have to consider future generation of the European region? This is one of the case examples. And, well, this case study is based in Paraguay. Where is Paraguay? Well, Paraguay is a South American country, and we decided to work with this country because the country has a high chikungunya virus incidence and there's ongoing climate health research needs. Also, the country has a policy gap. The National Adaptation Plan lacks resources and measurable health sector metrics. And, well, Paraguay's limited resources and high disease incidence make it a critical health for climate health ethics. The next one, please. And for the non-academical participants using this methodology, we decided to work with women's grassroots organization. Why? Because women face elevated climate health risk due to gender vulnerability and specific health risks tied to their societal roles. We have some presentation and discussing today about this. We identify some barriers to the participation for women. And also in South America, women's grassroots organizations have an important role in advocacy. They have a strong history in environmental and reproductive rights, shaping ethical research and policy. In this case study, we are doing an intersectional approach. That means that we are considering the intersection between gender and other groups that are facing greater climate health risk, such as indigenous community and LGBTI communities also. And we are using a federal strategy, which means that for the context, in South American countries, often have centralized policies concentrating research and development benefits in the capital cities of the country. So we prioritize organizations that is based in other geographical areas rather in Asunción City, which is the capital of Paraguay. The next one, please. Related to the ethical consideration of this case study, the first one is justice and fairness in research. Vector-borne diseases has disproportionately impact on low-income countries. And related to distributed justice, we are considering future scenarios. Related to procedural justice, this is a way to involve impacted community in decision-making process. And this is also we identify research gaps, limited ethic analysis in climate health intersection, and in the academic field, we need more comprehensive review in Spanish. And the second ethical consideration for this case study is epistemic justice, which is also, we are discussing recently about this type of inclusion. There are not enough inclusion of indigenous, local, and grassroots communities. Their knowledge and adaptation strategy are often overlooked, and we identify some benefits of the co-producing knowledge. This is a way to addressing literature gaps, and we also have advantages of this collaboration work. So the co-production of ethical rules illustrates a transdisciplinary approach. We combine academic insight with local experience to create and recreate ethical rules. This is also a way to empower marginalized groups in research and decision-making process. And there are lots of outcomes, but the main are that this is a way to build capacity and foster social dialogue. This is a way to address ethical dilemmas collaboratively. This is a way to develop ethical rules for addressing complex cases. And I have to expose two recommendations related to this case study. The first one is to adopt this methodology for other ethical research, because the co-production with stakeholders is a way to review ethical rules, and because of incorporates non-academic actors into the co-production process, it's important, and we are making methodological changes for doing that. And the second recommendation is to engage women's organizations, because it's a way to identify stakeholders in the region with a proven experience, and this causes reduce vulnerability, prevent maladaptation, and foster transformative change. This is a work that we are doing this year, so I'm excited for your comments, suggestions, and inputs for the work that we are doing. And well, thank you everyone, and especially to Adrienne, Cheryl, Rose, and Romina for the feedback for this presentation.
Thank you, Maria. So we'll move to our third presentation, and then we'll have time for discussion. So our third presenter is Guimel Peralta, and with co-author Tatiana Carazo, he's going to discuss some justice concerns about the conduct of high-income country research in low-resource host countries. So builds on the previous one. Their case highlights opportunities for host countries to benefit from research on dengue by focusing research on environmental conditions and vector control rather than on vaccines and products that are too expensive for widespread host country access. Over to you, Guimel. Is it working?
Thank you. Hello, everyone. Thank you all for being here, especially at this time when I'm sure the jet lag is kicking very hard. And many thanks to the Planning and Steering Committee for the organization of this global forum. My name is Guimel Peralta. I'm from Honduras in Central America. And today I will talk about dengue and climate change, exploring bioethical challenges in global health research. This collaborative paper was submitted with Dr. Tatiana Carazo from the Central American Technological University in Honduras. First of all, dengue is a mosquito-borne infectious disease. It is highly prevalent in regions of the global south, particularly in South Asia and South America. Climate change is a challenge that affects the entire world. However, regions with compromised socioeconomic and health conditions are the most vulnerable. As global temperatures rise, vector-borne diseases like dengue are spreading beyond endemic traditional areas, creating new health risks worldwide. The regions most affected by climate change, such as Central America, face both increased incidence and resource limitations. Dengue was a disease that affected only the global south until recent years, in which developed countries have experienced a spike in the number of autochthonal cases. Climate change has a significant impact on vector-borne diseases as temperature influences the life cycle and longevity of mosquitoes. In this map, we can see the susceptibility for dengue transmission that is predominant in countries of the global south. However, this other interactive map shows the number of months per year when disease transmission by mosquitoes is possible, and the projection for the next 25 and 50 years, with the impact of climate change unmitigated. As we can see, the transmission will be more suitable even in non-endemic countries of the global north. Honduras exemplifies the intersection of climate vulnerability and health challenges. As temperatures rise, mosquito populations thrive, resulting in higher transmission rates of diseases. The country faces unique challenges due to limited resources and the growing impact of climate change on public health. Limited resources make difficult to address the health impact effectively, highlighting the ethical need for targeted support and research. These images show the impact of 2 consecutive hurricanes that impacted Honduras and the Central America region at the end of 2020, with only few days of difference between both. This same panorama is facing right now Honduras because of the effects of a tropical storm that is causing inundations and destruction with continued heavy rains for the past 7 days. The global incidence of dengue has increased dramatically in the past years, with over 6 million cases reported in 2023 and approximately 5 million cases by mid-2024 alone. This contrasts sharply with the 500,000 cases reported in 2000, reflecting a marked upward trend. Severe dengue affects approximately 5% of all dengue cases, manifesting with symptoms such as hemorrhage, organ failure, shock, and in some cases, death. Endemic countries in the global south experience higher incidence, often without equitable access to vaccines and other prevention measures. This is the difference between countries in the global south and US, for example. Less favored people are the most vulnerable to suffering from the disease and its complications. Dengue vulnerability includes poverty, children, elderly, and climate impact. And these images are very common in our countries. Primordial prevention, a public health strategy, seeks to eliminate or reduce risk factors by addressing underlying conditions to minimize disease spread. Addressing root environmental and socioeconomic factors, such as water, sanitation, and housing, is an essential ethical priority in dengue prevention. Funding for this intervention is often overshadowed by investments in market-driven. This diagram shows the integrated vector management, a global strategic framework by the World Health Organization that addresses the root causes of dengue and other vector diseases. This includes capacity building, integrated approach, and broad collaboration, among others. However, this is primordial prevention, and we know that it's rarely reached in the not developed countries, disadvantaged countries, like Honduras, for example, that usually face socioeconomic and political issues frequently exacerbated by climate change. This brings us to talk about vaccines as a primary defense against dengue. Since only symptomatic treatment is available and the spread of dengue is facilitated by climate change, primary prevention, such as vaccination, emerged as a key area for medical research. Pharmaceutical company Sanofi, based in France, developed the vaccine Dengvaxia, which is currently used for secondary dengue, targeting individuals who have already been infected. At the end of 2023, another vaccine, Qdenga, developed by the Japanese pharmaceutical company Takeda, was approved for primary prevention. However, both vaccines face accessibility issues in low middle-income countries, where they are most needed. This brings us to discuss about the ethics of vaccine access in low middle-income countries. Dengue vaccines, while essential, remain largely inaccessible in these countries due to high cost and logistical challenges. This diagram illustrates this problem, and I'm sure you remember this. This shows the abysmal differences in COVID-19 coverage, vaccine coverage between low-income countries in comparison with high-income countries. An example of the ethical challenges in this area is the Qdenga vaccine. Although it was approved with demonstrated efficacy and safety, its prohibited cost, driven by pharmaceuticals' monopoly on production and distribution, prevent its inclusion in the national immunization program of low middle-income countries without substantial external financial support. Another serious ethical issue arises in Honduras and other low middle-income countries where that population participated in clinical trials for the Dengvaxia vaccine. These trials demonstrated that the vaccine, while effective in individuals who had already been infected with dengue, increased the risk of severe dengue for those without prior exposure. Although both vaccines have been approved, they remain unavailable in Honduras and other countries where their clinical trials took place. Meanwhile, these vaccines are easily accessible for travelers to endemic areas in some developed countries. This means that less favored countries, disadvantaged countries, although served as trial populations, receive no tangible benefit from the research. This imbalance is due to multiple barriers, including the high cost of vaccines, limited infrastructure, logistical challenges, and insufficient resources. This brings us to a question. What strategies can ensure affordable access to vaccines for the communities that need them the most? Funding agencies, including World Health Organization and the Global Alliance for Vaccines, have a responsibility to ensure equitable access to life-saving interventions in low middle-income countries. A shift towards supporting sustainable and community-focused prevention efforts is essential to addressing the root causes of dengue. In this context, research on the dengue vaccine serves as an example of how the health research agenda related to climate change could be shaped. The ethical implication of conducting research in low middle-income countries, particularly regarding benefit sharing and justice, have been extensively discussed in bioethics literature. Low middle-income countries often serve as research sites without sufficient benefits flowing back to these communities. Another factor to take into consideration is that the vaccine development and distribution are often driven by economic interest, rather than prioritizing the health needs of the most affected population. This approach leaves low middle-income countries, which bear the greatest disease burden, with limited access to life-saving interventions. Addressing the ethical imbalance between profit-driven research and equitable healthcare access is essential for global health justice. This graphic shows that only 1 to 2% of the global spending on health research and development targets neglected diseases. An important strategy to narrow these imbalances is to empower low middle-income countries in global health research. Low middle-income countries should actively negotiate for protections and benefits in international research supported by capacity building efforts to strengthen their role. Empowering low middle-income countries as stakeholders, such as government, academics, and community representatives, allows for better negotiation and secure protections and benefits for their population. International guidelines call for collaborative decision-making, but practical support is needed to strengthen local capacities for ethical oversight. The following recommendations are essential to ensure that vulnerable populations are both protected and benefit directly from global health research efforts. Global health research must prioritize local health needs through collaborative partnerships with low middle-income countries. Ethical reciprocity and benefit-sharing frameworks are essential to ensuring that research aligns with public health priorities in vulnerable regions. Invest in capacity building to help low middle-income countries negotiate terms that protect their interests. As climate change accelerates health risk, ethical global health research is more important than ever. Ensuring fair benefit sharing and protection of low middle-income communities should be a guiding principle in all international collaboration. Equity in global health research means not only protecting vulnerable populations, but also empowering them to benefit from scientific advances. The question remains, and I bring it to you to find together a possible solution. How can we build a future where ethical reciprocity, justice, and fairness are integral to global health research in a climate-challenging world? Thank you very much.
Thank you, Dina.
Okay.
So I recognize there's no fair and equitable way to recognize all the hands that are going to go up. So I'm going to actually sort of, in the spirit of things, have a modified prioritarian approach. So if you have raised your hand and had your question asked in the plenary, I'm going to ask you to refrain from raising your hand and maybe ask your question to the person that you wanted to direct it to over wine while we're having dinner. With that prolegomena, we have about 10 minutes for questions. Is there anybody who would like to? We've had 3 very stimulating presentations, so the floor is open for questions. Florencia, do we have a microphone dispenser? Oh.
Thank you. Yeah, I've already asked, but I couldn't not raise another one. What you were presenting, Gimel, it's very interesting, but we've seen it also with COVID. And my question, not only to you, but also profiting that Qala is here in the room, Qala Science, is we have a system in the Americas, which is a revolving fund. I was wondering if it wasn't involved, and normally it works with vaccines, so it is a possibility, but I don't know how it is working or if there are problems or whatever, so I wanted to connect your talk with these possibilities. We know that there is not like a COVAX as it was before, but we do have the revolving fund, so I don't know. So that is.
Thank you very much. In fact, in the past few months, 3 or 4 months, the Ministry of Health in Honduras is negotiating with different partners to ensure these vaccines reach the population. But to date, that is not possible because they have to negotiate with companies and pharmaceuticals. This usually is.
Revolving fund is PAHO.
Yeah, I know. Yeah, that's a possibility. In fact, PAHO is part of this conversation with the Ministry of Health. However, they have to find a mechanism, like they say with COVAX for COVID-19, but we remember that vaccines for our countries not reach the population at the same time that reach the population of the high-income countries. So this is more difficult for population. Right now, they are negotiating terms to ensure these vaccines for population.
Yantina, I'm going to maybe suggest everybody stand up and do a couple of jumping jacks. Everybody's looking like their circulation is thing. Yantina, go ahead,
Hi.
please.
Thanks for those 3 presentations. My question is for Maria. I was a little bit saddened that your conclusions were about the method and not what you're learning. And I wonder if you could just tell us a bit about, even if you're still in process, but what are you learning in terms of the kind of rules and what is different from what you had expected?
Well, thank you for the question. Yes, we are working on this case, and we are in the process of having the ethical conversation. And this is a pilot case for this methodology. This is also we are working on a paper for this kind of methodology. So we don't have the results of the study yet. That's why the conclusions are related to the methodology and not of the results of the research project.
Yeah, just I was going to ask, maybe just a little sample of what's happened so far. Yeah.
Just a taste of what is different in your discussions. What are you learning that's different?
Yes, Romina.
one example about our own process of building not the method, but the protocol for implementing the method. And in doing this, we realized that for starting the conversation involving the non-academic and academic parts, we need some kind of a strategy for people being comfortable with this kind of conversation that is transdisciplinary. So by realizing of this, what we did is to develop some kind of a dynamic involving theater and moral dilemmas, and something that in Spanish we call teatro foro, that this is a kind of theater that put participants in the role of being judges. So by implementing this, we are hoping to resolve this first aspect that we faced by developing the protocol.
Okay, coming across here. Thanks.
Thank you. Mine is more of a comment rather than a question from something I've heard from this conversation and what was said in the morning about it's about equity. You have mentioned that we have the for-profit organizations who should find a way of seeing how they can be able to respond to the needs of low middle income countries. However, I think that sometimes we do tend to forget that this like pharma, because they are profit oriented, it means we also need to find a way in which we can be able to also meet their needs. So when we are having these conversations, we need to also think about how are we able to also meet their objectives, as they should be able to also meet the objectives of, like the populations they are serving. This includes also the academia. I heard in the morning that we should be able to cater for the needs of the communities. However, the academia needs to also be able to benefit in one way or the other. So how do we ensure we have equitable partnerships? Thank you.
Who on the panel wants to tackle that or respond to that comment?
Yeah, thank you. The objective of my talk is precisely that, to mention about the big elephant in the room, that is big pharma, because they driven by economic interests, and there are market profitable like vaccines and pharmaceuticals and medications that usually are more driven profited than primordial prevention. So in each discussion about this, big pharma is involved with negotiating terms, with governments, with institutions. Representatives of big pharma are in the room. So we have to improve in our countries the capacity building to negotiate terms that afford low middle income countries to benefit from this research that usually take place in our countries, because usually our countries are the last that receive those benefits that we are seeing right now in dengue, and we saw it in COVID-19.
Yeah.
Thank you.
We have a question. I see one hand here and then one at the back, and then we'll move to continue deliberations in our breakout groups.
Hello, and thank you very much for very good presentations. For the presentation on dengue, which I'm very interested in, I'm an infectious disease scientist, so I was wondering, for industry, or sort of for vaccines as a solution, it's too often the case we push vaccines very quickly as the solution. And so I'm just wondering if there could be ways of exploring, additional alternatives that builds into local knowledge and indigenous systems, and finding ways in which those are going to be empowered. And I'll give, examples like dengue now. There are two parts to it. Yes, climate change is playing a part, but the other part too is that we are developing better diagnostics, and so we are picking them up more. So in countries like Sierra Leone, where there isn't a lot of cases of, a lot of surveillance and diagnostics around it, people, we've been seeing it, but it's not been reported. But people, people find a way maybe of how it's resolved. They get infected, maybe it gets resolved, or maybe they pass away. So I think, is there ways in which we can push for alternatives, and then other than just all the time building on like vaccines that might take a lot of R&D, might require a lot of expense, becomes really expensive, and then it becomes challenging as a solution for low middle income countries, as a whole. Thank you.
Thank you. That's an interesting question, because vaccines are not solution, at least not the definitive solution. The solution is invest in primordial prevention that addresses the root causes of the infectious diseases, like dengue, for example, and other diseases also. But these usually don't reach the population in the short term. The governments invest in the root causes of the diseases, but usually when the government change with political issues, that we are facing that every single day in our countries. We were talking about that in our breakout group. Latin America is a region of conflict, and governments usually don't pay attention to the root causes of diseases. And I'm sure that this is happening in other countries also, other regions. But the solution is to invest effectively in attack or approach adequately the root causes of infectious diseases. Primary prevention goes later. That primordial prevention is first, primary and secondary prevention it is later. And primary prevention, like vaccines, is a partial solution to the problem.
Great, thank you. So there were a couple of hands we didn't get to. I encourage you who had questions that we weren't able to get to meet with the speakers. It's time now to move to our breakout groups, but before we do, a round of applause for our speakers. And hopefully everybody will carry energy into the final breakout session before we reward ourselves with yet another meal. Okay, thank you. Thanks, everyone.